Hello everyone, my name is Maria Aziz. Today I will discuss about increase information in nursing. So I will start my abstract. The healthcare arena, including education, research, administration, and patient care, has become inundated with advances in information technology. Over at least decided, we must view the change in healthcare as a challenge rather than a risk to our profession and assist others through the transition. Who knows what advantage will serve over the next few years? So, my introduction. Nursing informatics applications have increased significantly with the past few years. Nursing must now face the visit challenge of learning and working within the age of technology. Information technology influences the way nursing practice, how they are educated, and the method of providing and documenting patient care. In addition, advances in information technology have also become an in general link to the staff development and continuing education. Nursing and administrators have begun to utilize informatics application to assist with staffing, management, badges, and dismissing information. The nursing profession, like many other professions, continue to function delay within the realm of technology. Nurses educators provide instruction through web-based classes and integrate within discussion board and compromise it. Testing nursing students searching the internet for information to complete assignments, submit their work, view email attachment, courtesy of submitting a hard copy to the instructor. Nurse researcher utilize the work while at web to gather information and to distribute the resulting of their findings. Well, start with technology in nursing. So, increasing use of technology. Nursing encounter nursing encounters the use of technology delay. Also, technology is the base of change, the way of patient care delivery. Clinic and information system have replaced paper of the pencil charting, duplicated charting, and documentation are eliminated, and error reduction allows more time for flexibility in delivering patient care. Gone are the days of the time spent trying to discover illegible handwritten physician orders. The use of physician order entry systems allow orders to be entered at the point of care and provides alert to possible contribution of the patient, alert eliminating errors. Standard of care are also tracked through compromised programs. Blood pressure, temperature, or other vital signs are now taken electronically, recorded and tracked for trends. Nurses are alerted to any abnormal result based on previously established parameters programmed into the system. Uh, nurses um, Nurses are under constant stress and pressure to ensure medication are administered properly. POC barcoding help the nurse ensure correct medication administration through automated verification. The five rights are verify, preventing the medication errors before they can occur. Addition benefits de- derived from these programs include data capturing and reporting tools which make quality of care for JCO, risk management, and other quality assurance programs. Hold hand units are utilized to transmit patient information directly to electronic medical record, providing more efficient documentation with increased accuracy and continuously handwritten documentation was often inconsistent and pertinent. Patient information was frequently inadequate regarding nursing interventions, the resulting patient education or care plans compromises the va- val- validity or reliability of the data. Immediate access to the internet and its many resources eliminates the need for the healthcare provider to the care around numerous of binders, some paper reference materials. Using the internet, the patient now is more informed about his or her condition, medication, and to treatment. Patients are provided the address of informative websites to prior to the discharge from the hospital or leaving the physician's office. In some instances, the patient are able to use information technology to consist their primary care providers, office staff with question view the internet caregivers at the University of Texas MD Anderson Cancer Center in Houston have developed personalized web page for individuals in the brain and spine center. In the brain and spine center, the web pages are customized with a specific information regarding the disease process and also a description of pertinent clinical administrative process in the center. Once the patient has accepted their cancer diagnosis, many questions still arise from a treatment to billing process. The web pages are diagnostic to allow the individual patient to obtain information or pose question to any given time. Nurses with each of the specialized treatment centers selected education information to place on the patient's side. The Ventures administration had three especially diagnostic and service system that allows healthcare providers to access patient information nationwide. Once the individual has been placed in the system, all documentation of patient visits are real time. All the healthcare providers who see patient enter the information regarding their interaction in the computer while they are with the patient. Very detection is utilized in the Ventures administration faculties except for special cases. Physician order lab result, x-ray results, appointments history on physicals, medications and immunization are available at the signal touch through buttons on the bottom of the screen. The pharmacy is also automated. The pharmacy, oh my goodness, the pharmacy is also automated into the system. One downfall to the use technology in healthcare is the potential branch confidentiality and security pertaining the patient information at all times. Healthcare provider must be cognizant of federal guidelines regarding patient privacy, security, and confidentiality. The Health Insurance Probability and Accountability Act, according to the Act 1996, HIPAA guidelines, HIPAA, it's HIPAA guidelines address the issue of privacy and security and insurance and interaction regarding the diagnosis, procedure, and test and conditioners, operations, and any new software program in the healthcare arena. Management should ensure that they adequately meet the federal guidelines implemented in early 2003. And now I'm talking about response to a change. Response to change, as with any a new process, one will witness many varying attitude regarding to the change. Some individuals view change with excitement and anticipation of gaining of a new skill or as an opportunity to grow. Others view it is as a distribution or threat to their practice. Many nurses often resist to the change of advancement in technology because they feel it is intrusion into the routine of providing patient care. It is also noted that nurses question the security of their jobs and feel quote powerless with the a prolonged, extensive and quickened process of the overall change in the healthcare arena due to the informatics technology. One of the great sphere is that advancing technology will make the nursing profession absolute. However, information technology should be viewed as an assistant to the nursing responsibility on the decreased time spent with administrative duties, thus providing more time for hand-on care. Information technology demonstrated decreased medical errors relating to automated orders. Since nurses spend a greater portion of their time documenting information, adapting to electronic documentation is a much more difficult process than a physician. The age of the nursing experience, and the education level impact acceptance of the technology younger nurses acquire. Information skills while nursing school and more accepting to computer advantage. Those nurses who have been in the healthcare field for many years often find the change quite difficultly. They must simultaneously learn a new skill and new system programs which require additional time, not always readily available. Patients are the priority, and the computer skills are sequenced in when time permits. The difficulty applies in many different information systems. Multiple passwords that require much may cause difficulty in enhancement. Some programs require an input in every field, even when it's not applicable to the situation. Therapy comparing to individuals' time. In addition, other healthcare providers have indicated the training was not sufficient to enable them to correctly use programs, helping with transition. Helping with transition. Many faculty now employ nurses who have specialized in nursing informatics to assist with technology and transition. The nurses are involved in planning process science. They are familiar with the nursing process and workflow, and the informatics nurses can identify the correct software program to enable the healthcare staff function more effectively while helping the nurse personnel to protect the project change as a challenge and incentive of the street of their profession. My conclusion: information technology has integrated the healthcare arena. Administrators must ensure they have a well-structured plan to enhance the acceptance of technology advancement involving healthcare providers in the planning process is improved to facilitating the proposed change since it has been established that change due to advancement information technology will continue in healthcare, providing information regarding to the benefit gained by the new system will gain acceptance. And here is my references that I use it in my PowerPoint.